So now we have to talk about the anterior pituitary gland. There are 6 hormones in all. We're going to talk first about the tropic hormones. Tropic means to change or to turn on. So basically it regulates other hormones and it'll stimulate the growth of other endocrine hormones or glands. So those are TSH, stands for thyroid stimulating hormone. ACTH stands for adrenocorticotropic hormone. FSH and LH is under gonadotropins. FSH standing for follicle stimulating hormone, and LH standing for luteinizing hormone. They're all proteins or glycoproteins. So TSH, its target is the thyroid gland, and it'll stimulate the thyroid gland to secrete, thyroid hormone, which we'll learn later about in another video. It's stimulated by a thyroid releasing hormone and indirectly pregnancy, I guess, and for infants, cold temperature. And it's inhibited by, it's a negative feedback. So if there's an increase of thyroid hormone in the blood level, then it'll tell the pituitary gland and the hypothalamus to turn off the thyroid stimulating hormone. Okay, so now we'll go on to ACTH, which is pretty important. This is the hormone that's produced by the corticotropes. It targets the adrenal cortex. From the name you can tell. It helps the adrenal cortex to release glucocorticoids. Those are the corticosteroids, the cortisol, androgens, and to a lesser extent the mineralocorticoids, which we'll learn later about when we talk about the adrenal cortex in one of my videos. And basically what that does, what that's stimulated by is the corticotropin releasing hormone, or fever, or hypoglycemia, starvation, anxiety, depression, surgery. So cortisol is kind of like your sustaining stress hormone. So if you're in any of these situations, you kind of want to increase cortisol. And it's also negative feedback. It follows a diurnal pattern. So it's highest during the morning, and then pretty low during your evening sleep. Okay, so let's go on to the gonadotropins, the hormones that regulate the growth and development of the gonads, which is your sex organs. So a very interesting topic. So in the FSH, it's the in charge of the production of gonads. In the female, that's your follicle. In the male, that's your sperm cells. And the LH works with FSH to help the follicle to grow and mature, and also turns the remnants of your follicle into corpus luteum, a temporary endocrine structure. And it's instrumental to producing testosterone in the male. So LH is more the gonadal hormones, and FSH is more the production of the gametes. Okay, and obviously they affect the testes and the ovaries. They're both stimulated by the gonadotropin releasing hormone GnRH. Although FSH is inhibited by the inhibin, and LH is also known as ICSH in males, which is the interstitial cell stimulating hormone, and that produces testosterone. So, it also does a little bit of progesterone in female. So, I think the LH does more things. Moving on to the non-tropic glands, those are the growth hormone, which is a protein peptide. It's released by the somatotropes, which is why it's also known as somatotrophin. It has many effects. It's major target organs are the bones and the skeletal muscle. So it'll target the epiphyseal plates in the bone to increase long bone growth. And in the skeletal muscle, it'll maintain muscle mass. Basically, it has an indirect and direct mechanism. Indirectly, it releases insulin-like growth factors, IGFs. It's just a growth-promoting protein to help, the skeleton and the bone to grow. Basically, that stimulates uptake of nutrients from blood and incorporate it into protein and DNA and mitosis. And also, it forms collagen and deposits of bone matrix, so it's pretty important for your bones. It's an anabolic effect, meaning it builds up things. So the direct mechanism is that it does lipolysis in the adipose tissue, which is breaking down fatty acid, and it saves the glucose for the brain, so it's a glucose sparing effect. And also does glycogenolysis, which breaks up the glucose from the glycogen in the liver to get it into the blood. So it has a diabetogenic effect. It's anti-insulin because insulin decreases your blood glucose. And let's see. Yeah. It's a very complicated hormone. It has a negative feedback. It does the somatostatin, which is GHIH, the inhibitory. GHIH also blocks TSH, and so GH is stimulated by exercise, deep sleep, starvation, fasting. It's inhibited by an increase in blood glucose, increase in fatty acid, cortisol, obesity, and pregnancy. So if you think about it, there's a lot of blood glucose. You really don't need GH to be doing glycogenolysis. And its highest levels during evening sleep, so that's kind of opposite of ACTH. And there are some imbalances that occur. So in hypersecretion in children is gigantism. That's where you just keep on growing. Your body proportion is normal, but you could reach up to about 8 feet. I'm assuming some basketball players are probably, have gigantism, especially Yao Ming. And hypersecretion after the epiphyseal plates have closed in adults, that's acromegaly. It just means your face, your hands, and your feet just grow abnormally when the rest of your body doesn't grow. And you could also have pituitary dwarfism. That's just when you're really short, you don't have enough GH. And you can fix that with an increase, if you take synthetic growth hormone. Although I don't recommend for people who doesn't have dwarfism, because that'll actually cause fluid retention, joint muscle pain, diabetes, and promote cancer. Not a good thing. So acromegaly there's usually a pituitary tumor, and you could just remove the tumor and you should be hopefully fine. So the last hormone we're going to talk about is prolactin. We've already talked about it. It works with the oxytocin to help your milk productions. And it's an exception to the rule because it's regulated by an inhibiting hormone called dopamine. So if you have a decrease in dopamine, you have an increase in prolactin. And it's stimulated by an increase in estrogen, breastfeeding, birth control pills, and dopamine blockers. So those are the anterior pituitary gland hormones. Hope you've learned something.